Hi, everyone. Thank you for joining us today for this EWA community member webinar on communicating through the coronavirus era. I am joined today by this wonderful panel of experts who are going to have a great guided conversation on how you can do your jobs the best you can during this uncertain time. But first, I just want to give a few housekeeping notes before I introduce them and they can get the conversation started. I just want to remind you all that you can ask questions during any time of this webinar. We'll get to them at the end, but there's a questions box on your panel you can use and you can submit those questions anytime. And just make sure to include your name and your organization so we know who's asking the question. Also, there's going to be a survey that pops up whenever you leave the webinar. Please, if you can, it's only a couple of questions and your feedback means everything to us. We'd love to have more community member webinars and we'd love to know what kind of webinars you guys want to see and what content and questions you have that are really burning for you right now and that we can address. But with that being said, I'd love to get started. Here's our panel. We have with us today Valerie Fields, who is a teaching professor and also owns her own communications firm. She's a teaching professor at UNC Chapel Hill. Sorry, I forgot to clarify. And then also she is joined with Adam Holland, who's the communications director of LaPorte, Texas School District. And then our moderator is Juan Elizondo, who is the comms director for the National Math and Science Initiative. So I'm going to pass it off to him and turn my camera off and join you guys at the end for the Q&A.
Thank you, Allison. Really appreciate that. And like Allison said, very excited for this first community member webinar. Excited to be here and really honored to be with Dr. Fields and Adam, who works at LaPorte ISD in Southeast Texas, southeast of Houston. So, of course, today's topic is about communicating in this coronavirus era and really thinking about how we communicate through long crisis and long recovery. So before we get to that, I want to do a little bit more introduction. You know, as Allison said, I am the Senior Director for Communication at the National Math and Science Initiative. Like many of you all, I am really underwater and inundated with communications right now. And so I look forward to hearing from Dr. Fields and from Adam to hear what they're doing and to hear their advice and thoughts on those topics. In addition, I'm pleased to be a community member on the advisory board for the Education Writers Association. So again, if you do have ideas, if you want to put those into the question box, we'll take those and hopefully have additional webinars. So with that brief introduction, what I'd like to do now is ask both Dr. Fields and Adam to give a little bit more introduction of themselves. And Valerie, why don't we start with you, please?
Thank you so much, Juan. Well, good afternoon, everyone. I am honored to be here and join with you all. Certainly, we're all adapting under these very challenging circumstances, but I appreciate that you took the time to join us today for this conversation and looking forward to any of the questions that come through the chat. As was already mentioned, I've been in the public relations industry about 24 years now. I own a public relations agency in downtown Raleigh, North Carolina, and I'm also a teaching professor at the University of North Carolina at Chapel Hill, where I teach crisis communication, and this is my 14th year teaching there at the university. And interestingly enough, when we left for spring break, none of us, back in early March, none of us were sure sort of what the rest of the semester would look like. And then we began to receive a consistent stream of communication over the next several days saying that, okay, you know, this is a heightened concern, and now they're beginning to have shelter in place orders in the West Coast of the country. I was actually on spring break in Las Vegas and following the news and watching my email from the university and seeing just how important the communication process was in keeping people informed when you're literally making life or death decisions. And so one of the things I hope that we get to talk about today is just how important our words are when we are in the profession of communication. And so I've been honored to do this work. I'm a certified crisis communication trainer as well. I do a lot of media coaching, a lot of media training, and now more than ever, it's been absolutely relevant to a lot of the work that all of us are doing. So Juan, thank you for the opportunity to share. And I thank Allison for the earlier introduction. And Adam, looking forward to having a great conversation with you.
Thank you. Adam, you want to give a little more introduction of yourself, please?
Well, my name is Adam Holland. I am the Director of Communications for LaPorte Independent School District. We are a large school district. Well, by Texas standards, we're about medium sized, with about 10,000 people in Southeast Texas. We are a suburb of Houston. And in fact, I can look out my office window when I'm able to go to work, and I can see the Galveston Bay. So we have had our share of crises since I've been there for the past 5 years, including a couple of floods and now this. My background, prior to this, I was also a communications director at Longview ISD, a school district of about the same size in Northeast Texas, where there were really no crises other than the local. And then prior to that, I was over on the dark side, I like to joke. I was a newspaper writer, also a radio news reporter for several years. So I've been on both sides of it, and I am very honored and pleased to be here, and look forward to hopefully providing some answers, at least answers about things that have worked for us and for me. And looking forward to it. Thank you.
Well, thank you both for a little bit more information about yourselves. Valerie, you have some presentation for us, and maybe I'd tee it up with the idea of where are we right now? I mean, are we still in the beginning of crisis? Are we somewhere in the path of that? So I tee that up and ask you to lead us through a presentation.
Absolutely, my pleasure. So I will click now and start to share my screen, and I will also take my webcam down so that makes the slides a little bit more clear for everyone. Okay, are you all able to see that okay? All right, so we'll just start with, yes, we're still in the midst of the crisis. If you go by the pre-crisis, crisis, active crisis, and post-crisis model, we are still actively in the crisis because it's still unfolding. There's still a lot of information we don't really know. There's a lot of communication that is changing and coming out every day. So people are still confused in many instances and not exactly sure about what to do. But I will share with you this graphic that I have on outside my office door at the university. And it says, "You're the PR expert. How do we say unmitigated disaster in a way that sounds like no big deal?" And so I get a lot of comments and I get a lot of laughter when people pass by and see that. But what people are relying on us to do is to be accurate and to be effective in our communication. But one of the things I think is often forgotten is to be empathetic in our communication. Dealing with a situation like what we are facing now, people are scared, and we need to remember that. But one of the things that can help alleviate fear is information. There's a theory called the uncertainty reduction theory. And basically, to boil it down, it means that when people don't have information, they will make up information. And people, just human nature, we tend to, I guess, imagine the worst possible case scenario, and then it drives and motivates our behavior from there. So we have a responsibility as communicators, as crisis communicators in particular, to help alleviate fear, and we can do that through our consistent, accurate, and constant communication. So just to make sure we're all on the same page, how are we in the industry defining crisis communication? It's as the strategic and coordinated process of delivering specific messages to key stakeholder audiences for the purpose of to inform, educate, and reassure them during all phases of crisis management and recovery. And recovery, it means, okay, we want business continuity. There's lots of conversation now about when do we reopen, but there's also a restore to normalcy desire that people have, and that is, we don't like this new normal, we want the old normal. But part of our communication responsibility needs to be that normal may not look the way it did before all of this started. And so not only can we do we have to focus on what we're dealing with now, but we need to be thinking ahead in terms of how we communicate in what will be our new status quo. Just some common characteristics of crisis. this graphic my students tend to respond well to. You'll notice Merv's manure coming towards the corner, and it's about to hit Sam's fans, right? So when the manure, if you will, hits the fan, typically we see what then is the making of a crisis. And some common characteristics that you'll see is that crises they create chaos, confusion, and collateral damage. They can quickly get out of control, as we've seen, create undesirable, represented by an undesirable combination of events and activities. Hard to predict all the areas that will be affected, and there are countless unexpected consequences. Now, one of the things that, in terms of what we are facing now as a nation and as a world, are the unexpected consequences. I think 6 weeks ago, no one would have imagined that toilet paper would be a high commodity item, right? That people would begin hoarding toilet paper because they're panic buying. And so once we realized that that was the thing, everyone hoarded the paper. We were told to share a square with our neighbors. We were told that everything was going to be okay. There's no shortage of any product. We just needed to shelter at home and be responsible and look out for each other by staying put. Well, then we received a report and growing reports about infection rates higher at meat processing plants. And so now, where we had no anticipation of the meat processing industry being affected, now we have a whole new sector of people who need intense scrutiny and medical care. We have an industry that's going to come to a screeching halt because of the virus. And then we have the reaction and panic buying that's going to ensue as a result of the media coverage that says, oh, well, now there will be a shortage in our supply line. And so if you had the conversation 6 weeks ago about what industry would take the hardest hit, we'd all thought it was just healthcare. We wouldn't have anticipated toilet paper shortages, and we would not have thought that there'd be a meat shortage when we were talking about a medical crisis. So certainly the countless unexpected consequences are a big part of crisis communication and crisis communication planning. But, and the last bullet, in every crisis, there's also opportunity. And so for organizations and brands and corporations who are having to make very tough decisions or needing to communicate with a lot of people, there's this amazing opportunity to not only reach out and do the right thing and help a lot of people through this very challenging time, but there's also the opportunity to establish your brand and build credibility in the midst of crisis as well. This slide is just levels of crises. I won't go through each one, but we sort of work our way up through issues and incidents, which are localized, accidents, emergencies, and disasters. And where I think most organizations find themselves now, or in the past several weeks, are at the organizational crisis level, which is that critical or decisive point where our response to an issue, an accident, an emergency, or disaster threatens the operations, reputations, and future standing of the organization. There certainly are thousands of companies now that were fined 2 months ago that are at the threat of not existing probably within the next 2 months. And that's an organizational crisis level that we're all having to face in different ways. For our crisis management process, it's really about prevention, preparation, and response. And then after our response, we look back in a reflective way to do an assessment and do an evaluation, and then revision to see what we learned, what we could have done better, and if what we did was effective. The goal of crisis communication is to effectively inform, educate, and reassure stakeholders while simultaneously reducing or eliminating the potential harm or damage inflicted upon the organization and its stakeholders. And when people ask me, okay, what do? We've never seen a crisis like this before, or we've never endured a crisis of this scale or magnitude before. It's so simple, maybe not easy, but certainly quite simple. We need to tell the truth, we need to tell it fast, and we need to tell it frequently. Tell the truth, tell it fast, tell it frequently, and tell what we do know, and tell what we don't know, and why we don't know it, and then also what we expect to find out, and then share with people what our communication process will be moving forward. In our communication priorities, there are types of information that people need. And the first two are instructing information and adjusting information. Instructing information tells our stakeholders how to physically protect themselves. For example, the house is on fire, get out, evacuate using the back stairs. Or this virus is spread through the air, through touch, through close contact. So you need to wash your hands for at least 20 seconds. You need to physically distance by at least 6 feet, and you need to not gather in large crowds. That's the instructing information that tells people how to remain safe. But now that everyone is safe at home, people are wondering, how did this happen? Why did this happen? And can this happen again? And that falls into the category of adjusting information when people need a psychological reason or rationale to understand what happened and understand what's being done to prevent it from happening again. And so that's kind of the information that we're receiving now. Everybody is being told to stay at home, so people are cooperating. But now people are speculating, and we are wondering and guessing, and social media is fueling a lot of rumors and disinformation and misinformation. And so the adjusting information helps us understand how we can remain safe. And then beyond that, once we're on the road to recovery and restoration, we have our reputation repair process, so we can evaluate, look back, see what worked, what did not work, and were we to face a similar situation in the future, what we could and would do differently. I was asked in preparation for this conversation to share just some common crisis communication mistakes. And I categorize them in 3 big groups. One is misplaced priorities. 2 is focusing on fear and not on the facts. And 3 is having a short-term outlook versus a long-term outlook. So with misplaced priorities, and not just with the COVID-19 crisis, but with any type of crisis, what you'll see is that an organization is so worried about its brand and its reputation that maybe it doesn't take the responsible action of putting people and its stakeholders first. A lot of times, my toughest conversations in preparing a crisis communication strategy are the legal liability versus public safety. The lawyers are at the table talking about what will happen if they end up in court, and anything that we say will be used against them. And that may or may not be the case. However, from a communication standpoint, it often requires an immediate response, because if you allow someone else to tell your story for you, you'll never gain control of that narrative. And so we're back and forth, the PR communications people with the lawyers, trying to find the balance of what is need to know information and what is information that people just want to know, and what do people have a right to know. And so we're sort of navigating between those areas. And then misplaced priorities, when we as a brand or an organization or an institution become more concerned about me and mine versus you and yours. And our focus on fear, not facts, that's when you see reactions instead of responses. Something comes out and a brand just immediately reacts in a defensive posture to protect the brand. And instead of hearing what's being said by different stakeholders, we respond, and responding to that, we just kind of react to protect ourselves. And it's an instinctual thing that can be, it can be learned, which means it can be unlearned. Also, panic spreads with uncertainty. The more misinformation that's available, the more panic ensues, and that makes people uncomfortable. So we respond to the panic instead of to the information that helps people process what's actually happening. And then that last bullet, that rumors and speculation fuel crises as well. And then the short term versus long term, we're looking at stopping the bleeding. But putting a Band-Aid on a gaping wound doesn't really work. So we need to look at the entire healing process and what does it take to walk all the way through the post-crisis and recovery phase. Also, there is the inclination to react to the external pressures. We got to get out there. We have to do something. We have to do something. And sometimes we're less inclined to think through strategically what that process needs to be. And then last, there's this push to be first, because the media is a business, and so organizations are competing to get the story first. but that sometimes is at the loss of accuracy. And then you want to be right. And what we're saying is it's a requirement at this point to be first and to be right. So we need to be both. These are just a list of crisis communication considerations, questions that we ask in the process to understand what we're actually dealing with, whether the situation is actually a crisis and what makes it so. What are the first steps that need to be taken? What do we know? What don't we know? Who should be notified and why? Who are our key stakeholders? Who are our key, who is our credible spokesperson? Because we need someone who can connect with the audience, and that the audience then identifies as a reliable and credible source of information. What are our key vulnerabilities? What is our internal communication process? What is our external communication process? And then just ask the question, okay, there's a lot of uncertainty here. There are a lot of things that will change over time, but what's a reasonable expectation for a response based on what we know and where we are right now? And then finally, what's at stake if we don't respond at all, or if we respond in a way that does not resonate well with our stakeholders? I say this a lot in class and a lot to my clients, that effective crisis communication is a function of management and operations. You cannot communicate your way out of something you behaved your way into. So when we're ready to tell a story, we have to have taken action also. Here's what we did, and now we're going to tell you what steps we've taken to help resolve this crisis and return to a state of normalcy. And what is our response process? To stay on message. We've anticipated what the questions will be. We know what we know what we don't know, and we need to communicate both of those things. Do you want an overarching messaging strategy? You want a talk track that addresses all of the relevant topics that may come up, and then you want supporting talking points, which can be anecdotal, which can be data or statistics, to underscore each of the talk tracks within your overarching messaging strategy. And then finally, just to not forget the role that social media can play during a crisis. That's where a lot of information gets out of control. And so if we are establishing ourselves as a credible source of information, we can't just use our traditional media platforms. We need to also be as effective and as active in reaching stakeholder groups on social media as well. And then this is what I teach at the Centers of Trust when we're having difficult conversations, when we have people who are on different sides of an issue under a crisis situation. One of the ways to help advance the communication process is to identify our common goals, our common grievances, and what works for the common good. I refer to those as our Centers of Trust because they help us in how we frame our communication efforts. And then as we've all heard the phrase, but fire, ready, aim doesn't work. There's a process, and that procedure matters. It's ready, aim, fire. And in that same manner, it's listen and then think and then speak. So we need to hear what's going on around us, hear what our stakeholders are concerned about, hear what constituency groups are worried about. Think about how we coordinate that with our brand messaging, and then we speak. So we need to communicate what do we say and do next in light of what we're facing now. We need to communicate about our planning process, what our new timelines are. For example, a lot of schools and universities still don't know what the summer sessions look like, still don't know what the fall semester will be like. I don't know, or we don't know, is an acceptable response, but share what you do know, and then when you expect to know more. And that is part of the communication process. And then we need to balance what I was asked to talk about, how we balance sharing good news when there's so much bad news and so many people are struggling. And the balance is the need to know information with some good news that people would want to know just to feel better in the midst of a lot of challenges and chaos. And we can also make personal videos so that our audience feels a little bit more connected with us as well. And so that's my presentation, and I'm happy to turn it over now and then take questions at the end. Thank you all.
Valerie, thank you. That was incredibly valuable, and just got so much from that. I want to start the conversation. Adam, tell me what jumps out at you from what Valerie presented. What are the key takeaways that you grabbed immediately from that?
Well, immediately was communicating with a purpose is how I would put it, but being truthful, being straightforward in your communication, and then she wraps up with social media and mentioned that it can get out of hand very quickly. In fact, someone told me a couple of years ago, he's an older gentleman, that social media would end up being the end of the world. And we've had a few situations where I think maybe he was onto something. I think that is even a better reason to communicate accurately, preferably as quickly as you can. Communicate accurately, because once it's out there, back in the day, you had to work double time to reel it back in and correct the information and get the correct information out there. These days, it can be next to impossible. And we're going through a little bit of that now at the school district.
Can you want to talk a little bit more about that? Tell us, help us understand what's happened and what you've learned from that.
Well, first of all, we have at LaPorte ISD communicated from the get-go what we knew. And sometimes, as Valerie said, the answer has been, we don't know, but we're working on it, and we'll let you know as soon as we find out. Like Valerie, we went into spring break. We put a warning out that if you were traveling to Italy, you're going to have to quarantine for 14 days. So, of course, several employees decided we might want to go to Italy. But joking aside, everything fell apart very quickly. And we didn't know what was going on. We know that we had this politician saying one thing, this politician saying another thing, our county judge in Harris County saying one thing, the governor saying something else. And and I know that this has been going on across the country. We have a mask order, for example, in Harris County. I should be wearing a mask right now. Don't tell anybody. But for the rest of the state, it's not an issue. So we, and I need to land this plane, but the bottom line is the information that was released to us, what we knew and what we could state as fact, we released it, and we did not hesitate saying, hey, check back with us. We're going to let you know what's going on as soon as we find out. We're in touch with the county judge, with the education commissioner, with the school board, with this, with that. And that has, the issue actually arose with graduation ceremonies. There were several school districts around us that jumped the gun and said, and put out word just in the last few days that they would plan graduation, the actual in-person walking ceremonies in late June, early July at NRG Stadium or the Astrodome or wherever. And we had, based on information from the governor as well as from the commissioner of education, we anticipate not being able to get back in June, even into July. And furthermore, we felt like there were a lot of our students, a lot of our seniors who would likely be off at college, in the military, and not able to come back. What we did was we put out word that we would be doing a video version to honor our seniors, and that this is the best we can do under the circumstances. We made sure to point to the county judge's order, to the governor's order, and even included some information from the CDC about the peak and how it's changed. It didn't matter. Other school districts nearby jumped the gun and said, hey, we're going to have this. And so all of a sudden, our school district, we're the bad guys. And it's been brutal over the past several days. Thousands of people in the LaPorte Independent School District have jumped on us like no one's business. And when we were right the whole time. Now, a lot of these other districts they're backing off. And we just put out a communique last evening. You can see it at lpisd.org. It's written in the form of a letter from 2 high school principals as well as our superintendent that goes on to explain why we made the decisions we made, and what's ahead.
Yeah, I saw that.
I know I'm dancing around a little bit, but that really was in response to a lot of the social media backlash. And I think, unfortunately, being a former newspaper guy, people often read what they want to read. And so here we are.
I mean, you're right about a number of things, but what jumps out is once something is out in social media, it's out and it moves so quickly. And again, you're right. People self-select the types of channels that they read, and even if they're all reading the same post, maybe take different things from it. One thing you just mentioned, and Valerie, I'd love for you to weigh in here. So Adam shared that in their communique, they also referenced some CDC information. There's a balance, I would imagine, and that in fact I'm struggling with in our own work, of staying to our expertise and talking about what we know and what we're doing as an education service provider, and wanting to be helpful to our audience. But some of that is not my story to share, or I could get in deep water if I change a word or drop a word by accident and change the meaning of messaging from the CDC. So how do we balance that desire to be helpful with the risk of overstating or understating something that's outside of our knitting?
There's an opportunity to identify credible sources of information and then just present them as a resource. So you are clearly communicating, look, our role here is this. We're concerned about our students, our faculty, our staff, et cetera, et cetera. Here's what the guidance that we're following. And then here's a link to where you can learn more about that. The reason we're following guidance from this organization is because they are driven by science, and they have physicians and nurses and researchers and people who can quantify and have empirical data that support whatever conclusions they've come to. We're not the researchers, we're not the scientists, we're the communicators, but we're telling you our information and our decisions are based on this particular source, but if you'd like to learn more about them and other resources that we recommend, then here's a list of those. And that way you're not having to take ownership of someone else's message. What you're communicating is what the source of your information is and what you're basing your decisions on, which is what people really want to know, but you're also giving them the opportunity to go do their own research and find out if they consider it a credible source as well.
Yeah, I like that and I appreciate that, because again, you're right. You don't want to take ownership of someone else's message, and this situation certainly don't want to make a mistake in that critical messaging. Valerie, I want to stick with you because you talked about. I wanted to read the terminology. It was unexpected consequences. At the same time, our operations folks and those of us who are in communication, we're expected to anticipate things. How do you look at an unfolding situation and pick up little hints and ideas, trends, so that you can get ahead of things? What are some strategies in that?
I call it contingency planning. What's the worst thing that could happen at the worst time to the most largest number of people, and then plan backwards from there. Okay, we're hearing in January, we're hearing rumors of a virus that's happening in the Eastern Hemisphere. But we're complacent and we're fine here because it's not circulating in our media. But what we know is that we've seen trends like this before. So what we're doing in our crisis management planning and our crisis communication planning is anticipating that, hey, what if that crisis becomes our crisis? So now maybe our crisis communication plan was only prepared to deal with a breakdown in operations, or that our computers were hacked, or somehow data was breached. But now we're hearing there's signal detection, there's warnings, there's monitoring. There's enough going on social media that says, hey, there's something going on here in the world, and we can't decide that we're going to be exempt from it or somehow immune from it. So the first thing is just to listen at what's going on in the world around us and to not assume that we won't be affected by it. And the contingency planning basically is, if this, then that. If the worst thing happens, how will we respond? If we have to shut down for a week, what will we do? If we have to shut down for a month, what will we do? If we have to shut down for a year, what will we do? And to just bring that team together and imagine and work through all the possible scenarios. If you cannot physically have people on a campus, but you are required to continue their education, what are our other options? And so I think we just start with, what do we know, what are we hearing, and then what if whatever it is we're hearing grows to the worst possible case scenario that we can imagine and affects the most people we could possibly imagine, which this has. What will we do to continue life? Maybe not normal, in what we considered normal in the past, but how will we make it to the next day by taking the right decisions to keep people safe, to keep people able to survive through this, and to keep people encouraged that we will get through it.
Yeah, part of what I hear you saying creates additional challenge because many of us, get a little bit of tunnel vision, or we're looking at trade publications in our fields, and so this thing that started in China may not have immediately resonated to any of us in education of this could become our crisis, and so having that wide field of view, I think, is critical. Adam, many of us are in small shops. Few of us have a crisis person on staff. It's one of the many hats we wear. How have you juggled keeping the day-to-day operations, the things that you have to do for summer and fall, while also addressing this crisis in the spring and all the uncertainty? Talk about how you're balancing all the work.
Well, I honestly, thank you. I'm not sure that I'm balancing. I wish there were 28 hours in the day. And I do want to clarify something that I alluded to earlier and misspoke. I have it in my notes. I promise that staying in one's lane, particularly when you are a PR practitioner giving medical advice, what we do on our website is merely link to the CDC. I think we placed at some point washing your hands for 20 seconds and staying home if you're sick. But they're the experts. Johns Hopkins, they're the experts. We're the experts on education. We're the experts, particularly on our school district. And so we do stay in that lane. We link them out. They want medical advice, go to CDC. How do we juggle? Daily, I can tell you that in our organization, we have cabinet meetings with the executive cabinet, superintendent, and deputy superintendents, administrators. First things first, we check everyone's temperature. How are you feeling? What do you need? What have you accomplished? What's unexpected? Those questions we must answer on a daily basis. And truth be told, it is quite the balancing act, because I had all these plans yesterday to upload lesson plans to our new online school, and then this communique happened. So it's Juan, it's sort of like working in a newsroom when everything's quiet and all of a sudden the manure hits the fan. You just have to go with it, and that's what we do.
Adam, I want to stick with you for a little bit because Valerie laid out for us, I loved that chart of the type of where we are and describing us as an organizational crisis right now. You have what I think is fairly unique experience in disaster, because during Harvey, your school district was affected, you knew something was coming, knew it was going to be big, and then in the middle of all that, you personally were impacted. And so now you're juggling work and home and your family and your school family. Reflecting on that, how did you get through being personally impacted and having this grand, enormous thing that you had to communicate through work? And what might other people take from your experience?
Well, first, don't take my grown-up card, but I did have to take a few moments for myself to put my head in a pillow, because real quickly, we had never lived on the coast, and they said hurricane. I'm like, I'll buy some pork rinds and beer, and we'll ride this thing out. And my house, we lost pretty much everything, as you know. We were fortunate that we had gone outside to an RV that we own, and because the house was just, beds were floating around, everything, mementos, everything. And in the middle of the night, the hurricane spawned a small tornado, which was enough to cause a tree to crash onto the RV while we were in it. And so the roof is leaking. You can't step out because the tree's blocking it. But I had my charger and I had my cell phone, and honestly, Juan, I can tell you that I went a lot on just raw energy, just the desire to get the word out. I was not expected to do anything. I needed to feel valid in that communication process. Certainly, I didn't dispatch to the school district and to our stakeholders that I was holed up in a trailer somewhere. But that, I think, what got me through that was just the desire to maintain some sort of normalcy. And in my life, normal is communicating.
I appreciate
Not a great answer, but that's very personal answer, and that's what got me through it.
Yeah, very authentic. I really appreciate that, and appreciate you letting me ask the question. Valerie, you talked earlier about the importance of our words. And one of the things I've thought a lot about, both with our internal stakeholders and our external stakeholders, is a sense of loss and acknowledging it and not comparing loss, because we should recognize there are people who have different, perhaps greater impacts. But all of us, whether we're not able to graduate or we're not able to be in the classroom with our friends and our colleagues, we have loss. How, as communicators, do we, again, strike the balance? And maybe that's the theme of this, of striking balance. But how do you address both, with your students and with your clients in your PR work, acknowledging loss?
For me, the driving motivation in that has been validation. Because you're right, we're not comparing losses. There are people with real challenges. So me having slow Wi-Fi, that really doesn't register as a valid challenge. It's an inconvenience. But validating that what you feel and what you're experiencing is real is what I found to be the most effective. I'm not saying that you don't have a right to feel a certain way, because your feelings are valid and they are what they are. So yes, and my students who are seniors who are looking forward to graduation, they plan these big celebrations, family coming in from all over, and then having that deteriorate one layer at the time over the weeks, expressed to me that they felt awful for being upset. But the reality is they felt awful because they were losing something they had anticipated having. But they didn't want to express those things because they knew people were losing their lives. People were losing loved ones. But what I was able to say to them is, you have a right to feel the way you feel, and the job isn't to compare what you've lost to what someone else has lost. The responsibility is to acknowledge that every feeling and every emotion is valid. And I think when we're willing to do that and say, all of us are experiencing this situation in different ways. I don't understand all of the ways that people are feeling, but what I do acknowledge is that everyone is processing this in a different way and experiencing it in a different way, and those emotions are real, and you do what you need to do to take care of yourself, seek the help that you need, whether it's online therapy, whether it's joining an online chat group, whether it's calling up a best friend and just complaining about it because you're sad. But don't underestimate the significance of your feelings just because what you're experiencing isn't as large in impact, if you will, as what someone else is. It's not a competition. I mean, everybody is challenged in different ways. And so I think if we as communicators just acknowledge that everyone is dealing with this in different ways, and all of those things are real and all of those things are significant, but we'll all be there for each other in some form or fashion, it sort of levels the playing field in terms of how we help each other through a tough time without it becoming a competition of, well, my feelings are more valid than yours. Because anything that creates more division in crisis undermines the whole crisis communication process.
I appreciate that. Keeping that idea in mind, and we're going to have this last question for me, and then we'll open it up to the audience here. Valerie, how does a brand tell a positive story? And not even a brand, a district. Let's talk about Adams District. If they're doing something that's good for a part of their community, how do they put that in context of all of this loss and other parts of the community that maybe what they're doing doesn't precisely serve them, but it's still good news?
I think there's a fine line. I've seen some brands do it better than others, I'll say. The opportunity is, if you're doing something great in your community, then make that resource known. It's not, look how great my company is for donating this much money or these many materials. It's, gosh, look how much good has been done by our medical professionals when they had the tools that they needed, and we were glad to be able to be a part of that. The focus has to be about the we and the us, not about the me. And I think that was on one of the slides when I said misplaced priorities, when we put how can I shine my own light when so many other lights are shining much brighter? How can I help other people shine their light? And I think when you're doing the right things for the right reasons, then that story helps to tell itself. So just focus on the good that's being done, and then share what your role is in supporting that good that's being done, and make it less about you and more about the good work.
I love that. I often think about NIMSY getting the halo effect and really putting the shine on our teachers and students, and then we get the bounce back on that. So I appreciate you adding that. Allison, I think we're ready for audience questions.
So we currently don't have any audience questions in the queue. So just a reminder to the audience, if you want to submit a question for one of our panelists, there's that questions box right there on your toolbar, and just to include your name and affiliation. But Juan, if you want to continue, because I know you have plenty of things to ask. So when questions start rolling in, sometimes people, they don't want to be the first one to ask.
Got it.
So,
yep.
Well, may I interject something real quickly? Valerie, everything you just said in your last two answers also would work very well in a marriage advice webinar. I'm just saying.
Thank you. It's the whole crisis communication thing doesn't
Indeed it is.
That's right.
Keep that in mind.
Adam, I shared with you that we have so many audiences, and there's variation of the message that has to be delivered to each of those audiences. And I shared with you, I actually lost track of one of those variations. And so we were pushing out all this information, and I said, where's the email for that audience? And realized we forgot about them because there were just so many of them. Are there tools, tricks you're using, your team is using to keep track of everything that's going out so that things don't get lost in the mix?
Well, you're looking at the trick and the tool. And as far as different messages for different audiences, perhaps I'm breaking the rules, but our message is consistent. I can tell you what I do with this communique, for example, that we placed last night about our graduation and why we were doing what we were doing. The first thing that I do is I send that message, the same exact message, to our elected board of trustees. And I let them know, hey, I'm about to post this on the website. I'm about to tweet it. Our high school principal's about to read a version of it in an all call. This is what's going out. I give it a few minutes so that they know first. They're the elected officials with people calling them. They need to know what's going on. The same exact message goes everywhere. There are, at least in our district, in our situation, there's been no need to, other than to translate it to Spanish, there's really been no need to change anything, which, by the way, we do translate.
Yeah, I wonder if that's a factor of school district versus in our role as a service provider, because we think about our funders as an audience, our teachers as an audience, the parents, the district leaders who we provide service to, and they, in one way or another, pay for the service. Valerie, so one thing though I do want to say, Adam, is we have tried as much as possible to use the exact same version for different audiences when we can. But Valerie, talk about what's a good practice in terms of varying the nuance of the message when you're talking to different groups, particularly when there's so much happening.
Sure. One of the questions that we ask, even when we're trying to look for audiences that may be a level beyond our initial stakeholder group, I envision them as concentric circles. We have, those inner circles, and then we have outer circles. The question that we ask is, if we have these four stakeholder groups, who do each of them have to answer to? Because that may not be a direct audience for us, but it's an indirect audience. So if we have investors, we know the investors have to answer to someone. If we have children, or students, and those are they are considered one of our stakeholder groups, who do they answer to? Oh, they answer to parents. Okay, so we need to prepare a message for the parents. Well, who are the parents going to have to answer to, or have some type of conversation with, maybe employers. And so that employer group may not be our direct audience, but it's an audience that we have in mind for how we might need to tailor or tweak a message. And then the next question, the underlying factor is, what is their motivation? And that's the tool that we use to tweak the message one way or the other. Once we understand what their motivation is, our shareholders are going to be motivated by money. They care a little bit less about some of the other things, right? Our parents are going to be motivated by the care and protection of their children. And so we think about that message being in terms of, safety and priorities and keeping them safe and well and healthy and things like that. There's this one big overarching message, but the nuance is, what's the priority to that audience? Who do they answer to? And what is their motivation?
I love that. I love that thinking and that structure to help people guide through that consideration. Allison, I believe we have an audience question.
Yes, we do. We have a question from Glenda Salvador from Capital City Public Charter School in DC, where I am. They learned this week about a parent in the community that died due to COVID-19, and they're asking, what would you recommend about messaging this to the school community and others that might come, as these deaths, unfortunately, are likely to continue?
Adam, I wonder if you want to take the first stab at that, being directly inside a school district.
We actually had this situation come up. We had an employee who just prior to spring break tested. She tested, but they weren't testing for COVID-19. Doctor sent her home. Spring break happened. They brought her back in for testing, and she tested positive. And that incubation period, which seems to change every other day, it had not expired. So we basically had to send word out that one of our employees had tested positive, and the employee was at the campus while school was in session. And if you're any symptoms, call your healthcare provider, contact the Harris County Department of Health. We've had some deaths. They've been more indirect. The cousin of a student at this elementary school's mother died. We've pretty much left that alone. But we have communicated, if for no other reason than public safety and health interests, about the cases. Probably not the question that the person was asking for, but we definitely put the word out.
But I appreciate hearing the experiences that you've had and how you've handled that. Valerie, what's the thought process that the person asking the question might go through? What are the questions they should be asking themselves to make a decision on how to communicate a direct death in their community?
I know one of the first questions and concerns is, how much can we share? How much should we share? And what will be the fallout or the pushback of oversharing or undersharing? There has to be adherence to policy. So first of all, what is the policy of the school system in terms of communicating the information? Because the policy gives you parameters and guidelines that also support you legally as well. It is our school district's policy to release information about public safety, and then that takes the priority over family privacy, for example. So whatever the policy is, there has to be an adherence to that. I tend to err on the side of over communication, meaning here's what we know and here's what you can do to remain safe, because there is a phrase called negligent failure. And negligent failure to communicate something means if you knew you could have protected people from harm and didn't, there could be a legal liability for that. And so much, as already was shared by Adam, that here's what we know, here's what the risk might be to you, starting with the message of sympathy, empathy, condolences where it's relevant, or at least expressions of concern. And then here's what we know, and here's what you can do if you were possibly exposed. Here are resources that are available, and here's what the recommendations are from those resources, and here's how you follow up with those resources. But I know the concern is how much do we share without creating panic? But the greater issue is how much you should share to make sure people have enough information to make informed decisions.
Yeah, and that idea of policy, really, we're right now in crisis, so it's hard to be setting policy, but learning from this and either looking at policies, creating policies, revising policies when we do reach some new normal. We have just a few minutes left, and so I want to ask both of you, what are you doing right now for your clients? What are you telling your students? What should communicators be doing right now for the next phase, whether it's talking about summer school, the fall, the next crisis? What's critical for communicators to be doing right now? And Adam, Valerie, go ahead, please. No, please,
I'm
Valerie.
sharing that everyone should be adaptable. Let's not hold on to the memory of what used to be, because it's highly unlikely that we will see that anytime soon. And so the way we get through is to be open to what the new options and possibilities are, to just keep moving forward. It will not be business as usual. It will not be our old normal, but we will decide what the new expectation needs to be, and to be open to that. If we hold on too tightly to the past, then I think it spirals into something, because then we feel that we have no control. But if you're open to accepting the new ways that we do business, the new ways that we educate our students, the new ways that we have to conduct ourselves until we have a vaccine, or until we have more information about the virus itself, it's just really being open and adaptable to the possibilities of what to do to keep the main thing, which is keeping everyone safe. I think an openness to being adaptable and flexible in our planning is the key underlying message of what I'm saying to my students, and what I'm saying to my colleagues is what I'm saying to my clients.
Thank you, I appreciate that. Adam, what are you doing right now to be ready for whatever comes next? What are you advising to your team and to your, the leadership of your district?
Well, first of all, exactly what Dr. Field said. I would add to that there's a little bit of a fireside chat tone. We are empathetic. We're here. I have children in school. I have children. I have a wife who is a teacher who's going to miss her students. We're all concerned about our health and our safety, the economy, the fact that this is showing that it's probably going to happen again before the end of the year. And I think that our message, in addition to everything that is communicated on a regular basis about the business at hand, is that we're all in this together. We're going to make it through this, and we're here for you. And let's get through this together. And that again, it's more of a fireside chat type of tone that we're taking.
Thank you. I really appreciate the conversation and would love to keep going, but we do want to respect folks' time. So Allison, I'll turn it back over to you.
Great. Thank you so much, Juan. And thank you again to Adam and Valerie for taking the time, and Juan, of course, to join us today and have this conversation. I hope you found it useful to you and your work. Don't forget to take that survey that pops up before you completely close out. And hope to see you at future EWA community member webinars. Check back on our site, as we've been updating webinars and virtual events and online resources. And hope everyone stays safe while they socially distance. Thanks again, everybody.
Thank you. Bye-bye, everybody.